So let's bring in Nancy Cordes. She, as I said, was in that press conference, that briefing there, Nancy. So, Nancy, for Americans who are listening to what Speaker Ryan said, especially for those who are conservatives or members of the Republican Party, and they like what they just heard from the Speaker, but then you've got Republicans in the Senate like Rand Paul and Senator Ted Cruz saying, well, hold off, we don't really like this bill. There's a lot of groups that don't like it. How do they reconcile what they're hearing from the members of the Senate with what they're hearing from the House?
Well, in some cases, they're hearing the same thing from the Senate and the House. You've got conservative members in both bodies who are saying that they feel that these tax credits are too generous, that they essentially enshrine a new entitlement into law, that the Medicaid drawdown, which is something that they vigorously opposed, takes too long, and they'd like to see Medicaid funding reduced more quickly. So they have a whole host of issues with the bill, both in the House and the Senate, when it comes to conservatives. On the other hand, you've got a number of moderate members, particularly in the Senate, who have the opposite concern, that even though this bill doesn't start to reduce the amount of Medicaid funding going to the states until 2020, that it still is going to put Medicaid recipients in harm's way. And they certainly don't want the authors of this bill to change it to make that drawdown happen more quickly. And so that's why you just saw the Speaker of the House essentially give a sales pitch to his own members. Yes, you had members of the press in the audience, but what he was really doing was talking to his own rank and file, saying, look, I know you have all kinds of issues. I know you want a little more of this and a little bit less of that, but we are hamstrung. There's only so much we can do through the legislative process, and you need to get on board because the alternative is something that you like a whole lot less than what we're proposing, and that's the status quo.
And Nancy, did the Speaker in his remarks address the fact that there are people, critics, who have said, look, there are some 20 million plus people on the Affordable Care Act right now. What will happen to them if this new legislation goes into effect? And also how they're going to pay for it.
Not really. He did not talk about the criticism that you're hearing from groups like the AARP, the American Medical Association, independent analysis like the one that was done by Standard & Poor's that all say that you could have anywhere from 6 to 15 million people lose their insurance. When you speak privately to Republican leaders, what they'll argue is that these analyses don't take into account the fact that they're going to unleash so much competition in the marketplace, that they are basically going to remove so many regulations that at the end of the day, these insurers will offer more plans, those plans will be cheaper, and that you won't see as many people losing their insurance as you would think on paper. They also argue that it's a false comparison because when you've got a law like Obamacare that requires everyone to buy insurance, then sure, if you take away that mandate, you will have fewer people covered. But they say that's not their goal. Their goal is not to force a 30-year-old who's healthy, who has a God complex and doesn't want to buy insurance to buy it. They say they'd love that person to get insured, but that's not the government's role. They say their goal is to cut back government's role in health care and to take some of the strictures off the market so that it can operate more smoothly.
Nancy, while you were in that press conference with Speaker Ryan, President Trump tweeted, I'm going to read the tweet out for our viewers and put it up on screen. Despite what you hear in the press, health care is coming along great. We are talking to many groups and it will end in a beautiful picture. So my question, Nancy, is what are lawmakers saying to you about the outreach from the White House, from President Trump himself? The president is known as a deal maker. He campaigned on that, the art of the deal. Are they seeing the president reaching out to them, engaging with them to try to get this deal done?
Well, the president got an earful from conservative groups just last night, and they were not saying that they think that this bill is wonderful. They were saying that it doesn't look like a conservative bill to them. It's not what their members ran on, and they can't support it. And it's unclear what, if anything, the president or the Speaker of the House can really say to them to change their minds. You know, keep in mind that these conservative groups like Heritage Action or like Americans for Prosperity and this group of lawmakers lawmakers that call themselves the Freedom Caucus, the most conservative members of the House, have been a thorn in the side for leadership for years. There are any number of bills that Republican leadership has tried to put forward as an alternative to Democratic plans that have been sunk not by Democrats, but by their own right flank because those bills were deemed insufficiently conservative. And so the question this time around, and this is what Republican leaders are hoping, is that when push comes to shove, when this bill comes up for a vote on the House floor in, let's say, a week and a half, that these conservatives who are voicing concerns now are going to say, you know what? At the end of the day, I have to vote for this because I promised my constituents that I was going to repeal and replace Obamacare, and this is the only option I have to do it.
All right, to be continued, certainly. Nancy Cordes, as always, we thank you for your reporting. Appreciate it.
You're welcome, Vlad.